Hi, AMP Honors Program. My name is Julianna. I'm a super mentor here on the AMP Honors platform. And today I'm going to be speaking with Dr. Keith Mausner. I'm going to just kind of let him run through his journey and his specialty and what he does. And from there, I'll just ask questions and kind of pick his brain a little bit. So, Dr. Mausner, would you like to just kind of explain what you do and how you got there?
Yeah. Well, my name's Keith Mausner. I'm an emergency physician. That's my professional background and training. And I have a subspecialty in what's called EMS, Emergency Medical Services. So I went through training to be an ER doc, which was always my prime job. But then secondary to that, I had a special interest in working with pre-hospital care providers, so paramedics and EMTs, and how to train them and how to run an EMS system. So that's my basic professional background.
And did you,
So,
just a quick question, did you have to do like extra schooling for that, the EMS side of things, or was that kind of integrated into your curriculum in medical school?
no, that's a great question. So, first of all, I'm one of the old ones, okay? I graduated from medical school back in 1986.
Wow.
And at that time, even emergency medicine was a really new specialty. They'd only been offering what's called board certification in that for about 6 years at that time.
Okay.
So it was the youngest specialty in emergency medicine. And when I went through medical school, I had no idea that I truly didn't know that I wanted to be an emergency physician.
Mm-hmm.
I initially wanted to do primary care. And I started off in family practice. So the other thing I did was I went through medical school, and I financed my medical school by having a scholarship with the military. So I was an Air Force doctor. So I went to the University of Colorado, which was my home state, but I had my education paid for by the Air Force. And so I was on reserve duty while I was in the Air Force. And then when I was done with at least part of my training, I went on active duty and served that time. So I actually started off, I got out of medical school in 1986, and I went into a family practice program.
Okay.
And I found that I wasn't really suited to family practice. I enjoyed it. Well, I liked the generality of family practice and seeing all types of people and delivering babies and doing pediatrics and geriatrics and all of that. But on the other hand, I didn't feel that the specialization was quite enough for me.
Mm-hmm.
And I found that where I enjoyed working most was in the emergency department and in the intensive care unit. Because I really liked kind of the flow of things, the adrenaline of things.
A lot of people fear that.
What's that?
I said, I feel like a lot of people fear that aspect of, the emergency medicine portion of healthcare, is that adrenaline, the unknowns, the uncertainties. So I think it takes a special person, because for me personally, that's the part that I don't love, like I don't like the non-controlled settings. So that's interesting to hear that you say that.
Well, I think that's one of the interesting things about careers in medicine or nursing, is that there's so many different areas that you can choose from. Mm-hmm. And I think everybody finds what fits their personality the most. And that's what's so exciting about when you're preparing to go to school, or when you're in school, med school, nursing school, is to explore all those areas and find, geez, where do I fit in the most? In my case, I didn't really find that until after I was done with med school, and here I am training to be a family doc, and I was finding, wow, I'm really enjoying hanging out in the ICU or hanging out in the emergency department. And unlike a lot of my colleagues really look forward, and I'm so glad that people like to do this. They loved having appointments that, I'm going to see Mrs. Jones at 1 o'clock and Mr. Smith at 2 o'clock, and I'm going to take care of their blood pressure. What I found was I enjoyed being in an emergency department where I don't know what's going to happen at any moment. I found that really exciting.
I think that's
and
awesome.
I like the hours too, which is paradoxical. I think some people like to have really defined hours. I actually liked having different hours and shifts and I especially came to love the
Wow.
night shift.
That's interesting. I don't think I've ever spoken to someone with in your profession that has said that. So that's interesting to me. And just for my own, or for everyone on the AMP Honors Program, what, some people have that one moment where it's like, okay, I knew that this is what I wanted to do. Did you go through residency where you're like, oh, emergency medicine, or was it something with the Air Force that kind of sparked your interest in this, or in the family practice where you kind of knew like, okay, I want to get out of family practice and kind of transition into emergency medicine?
Yeah, that's a great question. I think the times when I noticed it the most was when I was in settings, whether it was in the ICU, the emergency department, or even on the floor, where there were kind of emergency type situations that required quick decisions and resuscitations that really made a difference to be able to think clearly and decisively and make that kind of a difference right then. And I think the people who like intensive care or emergency medicine or trauma surgery, those fields tend to have that kind of a mindset,
Mm-hmm.
as opposed to other people who would rather, I'm going to see somebody and I'm going to really think about their treatment plan over the next year and, getting their glucoses under control. It's
Mm-hmm.
just a different mindset.
Yeah,
And,
that's a good way
you
to look
talk,
at
what's that, Juliana?
I said that's a good way to look at it is, it is a different
Yeah.
mindset. You have to shift and look at it in that way.
Yeah, yeah. So I was into my second year of family practice, and when you have a scholarship with the military, they really have a lot of control over what you do with your career. And they had agreed that I could go and do family practice, and I realized, you know what, I really don't want to do that. I want to do emergency medicine. So I contacted the Air Force. I said, hey, I think I'd like to switch to emergency medicine. And they said, this was in 1988, they said, well, you have two choices. Either finish family practice and then you can do your active duty 4 years as a family doc, or actually at that time they had a shortage of emergency doctors. And it was such a young specialty then that they would actually put doctors, just as long as you'd done an internship, you weren't even fully trained, they would put you in the emergency department. So when I called up the Air Force and they gave me those choices, I said, you know what? I know I don't want to do family practice, so I'm just going to go on active duty. And when I went on active duty, they ended up basically saying, okay, you're not trained as an ER doc, but you're going to be an ER doc.
Oh,
And
yeah.
again, this was 1988. So, we were a young specialty. There were at that time a lot of people who were trained in the specialty, but still a lot of people were practicing emergency medicine then that had done other things and just said, okay, well, it's kind of general and I'll get by. And only in the military would they, put you in that type of situation, which was actually a really growing experience because, here I'm a young doctor. I've had 2 years of family
Yep.
practice training. And all of a sudden I find myself as an attending, practicing emergency medicine without the full training. So I ended up doing that. We got stationed in Albuquerque, New Mexico.
Okay.
There's an Air Force base there, and it had a hospital that was both Air Force and VA. So you ended up
Oh,
taking care of the Air Force active duty people, retirees, their families, and the veterans. And you did that all as an not fully trained ER doc. And so that really started to shape my perspective on knowledge and learning and how you learn and what you
mhm.
know. I knew I wanted to specialize in this field, and in order to do it, I had to finish my time on active duty, which I did for 4 years. And then after that, I decided to do an emergency medicine residency. So
Wow.
that 4 years was quite a shaping experience
Yeah.
because you end up practicing in a specialty before you're trained in it,
Hmm.
and then you go into residency and you've learned a lot of things, but on the other hand you've learned a lot of things maybe not the best way to do things, and you have to have a really open mind and you have to be really humble and you have to realize I need to learn how to do this the right way.
Hmm.
And so I did the residency in emergency medicine, and just, it confirmed my love for the field. I mean, it was absolutely, especially you've had time to mature, you know, you've been out for 4 years, you know what you really want to do.
Mm-hmm.
And you learn at such a different level when you've had that experience, because it's like every minute of learning time is just precious to you. And so towards the end of my time as a resident, I realized, you know what else I really enjoy? I really enjoy working with pre-hospital care. You know, at the place I did my residency, the Medical College of Wisconsin,
Mm-hmm.
you really had a lot of involvement with EMS. You know, you ran all the radio calls with the county EMS system. You know, you were working at the level 1 trauma center. And you also were a flight physician, a crew member on the helicopter. So you really got to take call and fly in the helicopter to do pre-hospital care, which involved a lot of settings of, you know, flying to scenes for traumas, and accidents and shootings, and then also flying to other hospitals where they had really sick patients that need to go to a higher level of care.
Mm-hmm.
So that was a wonderful experience. So after all that, I decided to do what's called a fellowship, and that's additional training after residency. So when I finished my residency in '95, I then did an additional year as what's called a fellow in EMS. And that was one of the early years of what are called fellowships in this subspecialty. You know, subspecialties are, for example, internal medicine is a specialty.
Mm-hmm.
And then a subspecialty of internal medicine would be like cardiology.
Okay.
Okay. Yeah, or general surgery is a specialty, and a subspecialty of general surgery would be like vascular surgery or cardiothoracic surgery. So EMS is one of the subspecialties of emergency medicine, and I did that in pretty much the early years when they were just starting to offer that as a new subspecialty. And so, yeah, I fell in love with that. And then my wife and I, we thought, well, where do we want to live? Because we had been in New Mexico, and then we came to Wisconsin, which is kind of near where my wife grew up, and did all this training. And then she's a nurse, and
Awesome.
she's a diabetes educator. And so we had enjoyed our time in New Mexico, and both of us really have a service kind of ethos to us, that we really like to work in underserved communities and provide service. And so we decided to go back to New Mexico. And so we went to a little town in northern New Mexico called Espanola, which is about 20 miles from Santa Fe, which is the capital of New Mexico. And Espanola has a small hospital, and it's a really impoverished county there. At the time we were living there, it was the poorest county in New Mexico, and actually was the third poorest county in the United States. And at the time I was there, it actually had the highest per capita trauma abuse or trauma death rate, and the highest per capita drug abuse mortality rate. So it was a real challenge. And you were working in this very small ER in a small community hospital. Most of the time you were the only doctor on, and you would get just amazingly challenging cases that you would have to, you know, handle, and if they needed more care, stabilize until you could fly them out, or, you know, sometimes admit, but very often you were transferring very sick patients to other hospitals. So it was a really good place as a young doctor to kind of cut your teeth on that. And then I had the honor the last year or so that I was there, because I had done that fellowship in EMS, I became for the State Department of Health, the EMS director for the New Mexico Department of Health, the EMS medical director. So I worked as a doctor with the State Department of Health developing policies for pre-hospital care, which was also a really...
Was that in the hospital that you kind of, that department was in, or was that outside of the hospital?
Yeah, that was a job outside the hospital. So in the hospital, like the first 3 years I was there, I worked as an ER doc, and I directed local EMS, our local paramedics. And then the last year or a little over a year, I worked both as an ER doc at that hospital, but then also worked at the state level. So, you know, with the State Department of EMS and other hospitals and other doctors, and serves on the committees that helped set the policies
Mm-hmm.
for caring for patients outside of the hospital.
And did you enjoy doing the policy piece of it? The, you know, like the more of the educational piece, is that kind of why, and I'll kind of get into the piece now, how you're more of an educator, is that correct? Now that,
Yeah,
okay.
yeah, and we'll talk about how my life is. I think it, you know, it's good to have an interesting life with unexpected twists and turns.
I
It
agree.
makes your life interesting. So, you know, I think the thing I enjoy most, other than the thing that I really loved doing the most, was practicing medicine at
Mm-hmm.
the bedside. But the thing that I enjoyed most, other than that, is being an educator
Mm-hmm.
and teaching and training. I don't so much enjoy, I think it's a necessary thing to do, but I don't enjoy working at the highest policy levels.
Mm-hmm.
I just don't enjoy the politics of it.
Mm-hmm.
I think politics is very interesting, but it's not something that I really enjoy engaging in. And doing that type of policy is very political, you know,
I
it
can
has,
imagine. I can definitely
yeah,
imagine that.
yeah.
And
And see, and that's an important thing, because, you know, you will have opportunities to do lots of things. And I think it's important to, as you go through your life, look at what are the things that I enjoy doing most,
mm-hmm.
and that also really suit my personality, and that where I can contribute the most and also enjoy it. Like, I know that I do a good job at pretty much everything I've done professionally,
Mm-hmm.
but I know there are certain things that give me especially give me joy and satisfaction. Those are the things that I gravitate more towards. And I think it's the best way, in my opinion, to live life is to find the things that you enjoy the most that become a passion, and that aren't a drag to you, or that you don't enjoy so much. There are other people that enjoy that. Let them do the things that they enjoy.
Mm-hmm. I think that's important for anyone to hear, is just kind of, you know, you were talking about even in when they had brought up in the Air Force, do you want to continue with family practice, or do you want to kind of do emergency medicine? And it sounds to me like you've kind of become comfortable with being uncomfortable, especially in a situation where, you know, you aren't trained and you're just kind of tossed into, you know, whatever's thrown at you. And I think, you know, those are situations that even I can speak to, that sometimes we learn the most and the quickest in situations where it's not very controlled and you are just kind of thrown in. Do you feel that, you know, during that time in New Mexico where you weren't trained, that you learned almost more than when you were going through residency? Or would you say that you learned from both situations that you were in?
You know, I think that's just a beautiful way of phrasing it. I think that when I was untrained and working as a doc in the ED,
Mm-hmm.
that it was a real challenge, because you learned your limitations of what you learned how to know what you don't know, and you learned how to ask for help, and you learned how to be humble in what you know. And everybody should do that, whether they're trained or untrained, because I don't care how well trained you are, you're always going to be in situations that are humbling and overwhelming. But
That's
I think how you deal with them really counts. So I think having that situation where I was kind of thrown into, hey, you're an ER doc now.
yep.
Oh, wait, this is what I wanted to do, but I wanted to get trained fully in it first. And oh no, I'm an ER doc now without being fully trained. It was stressful, very stressful at times, but on the other hand, it was a period of really focused learning. And then it was also a period of learning about yourself
Mm-hmm.
and how well you handle those types of situations, and developing your style for dealing with situations like that. So yeah, I think it was a really growing period. And then residency was incredible, because here I was around really accomplished, fully trained ER docs and seeing, oh, that's how they do it. But at the same time, I was saying, wow, I can see the same chaos and out of control
Mm-hmm.
situations that existed when I wasn't trained. They deal with it a little better, but the bottom line is that they've got the fundamentals to fall back on.
Mm-hmm.
And I think the biggest thing that you learn when you're training as a medical profession is to know your limitations and then have the ability to interact with others to get the help that you need, because your bottom line mission is helping people.
Right.
And
And
your bottom line oath is do no harm.
yes. And I was just going to kind of ask a question about, for students to hear and for me as well, is not to be fearful of asking questions. So if there's, if maybe explain to me and anyone else that watches is, how would mistakes that you've made, how is that kind of improved your practice, like going forward? Like maybe you made a mistake 20 years ago. How has that kind of changed your perspective or your way of practice today?
That, I think that's just a great question. When I was in medical school, I went to medical school from 1982 to 86. Mistakes were something people didn't talk about.
Mm-hmm.
And people you'd hear about mistakes and people would say, oh boy, did you hear about that? Did you hear what they did there? And they would almost imply, well, that happened to somebody else. That'll never happen to me
Mm-hmm.
or to my patients. And people were ashamed of making mistakes. And I think the big change that's happened over the last 20 years or so is that we're all acknowledging that we're just human beings. And that as human beings, we are fundamentally flawed in that we will always make mistakes. But one of the ways we can make up for that is by learning from them.
Exactly.
And not being ashamed of them. And one of the concepts, and I don't know if we'll have time to talk about it, but one of the guiding principles in my professional life is a concept called just culture. Have you heard of that in your training yet as a nurse? Or?
I have heard bits and pieces, but I think your explanation would help me understand it a little bit more. So I'm curious.
Yeah. Well, just culture is something that's pretty much existed in the aviation industry for a long time, or at least they try to follow just culture in the aviation industry. And so basically the basic precept of just culture is that all human beings are flawed, all systems are flawed, and we all work in systems. So therefore errors will be made. And so our goal is not to punish people for errors and not to make errors a subject of punitive action, but to make errors a subject of learning and growth for everybody. Because one of the problems you have is if you live in what's called a culture of blame, where if somebody makes a mistake, they're blamed for it and punished. If they're blamed for it and punished, what that creates is an atmosphere where people don't want to report errors. They don't want to talk about it. Lots of near misses occur. For example, maybe a nurse accidentally almost gives the wrong dose, 10 times the dose of a drug that she should have given, but catches it at the last minute. And she hadn't done, let's say, the correct checks on that dosing, but she caught it. Well, in the past, people would have just gone, whoa, no harm, no foul. I'm just going to forget it. That's a term that just belongs relegated to the past, and it's still used a lot. And really what it's saying is, hey, you almost made a mistake, but you caught it, no harm, just don't talk about it. You don't want to draw attention to yourself. You don't want to get punished. No, it really should be the opposite. It should be, hey, I'm going to tell my colleagues and our system about, I almost made this mistake. And you know why? Because I was distracted by this. And this step in our double check, sometimes it doesn't work because it's really easy to pass over that and to overlook it. And by having somebody who has the courage to do that, everybody goes, you know what? That's happened to me too. Wow, let's change the system.
Change, exactly. It's if you
And
don't.
then somebody is.
Go ahead. Sorry.
No, that's okay. You go ahead.
I was just gonna say, I think that goes into not only just medicine, but anything in life. If you don't, recognize things that need change and you don't bring them to the surface for everyone to hear or talk about or give their own insight on, change can't happen. So I think that's important that people kind of own up to, like, yes, I made this mistake or this near miss, but, like everyone's doing it. if people kind of know like, oh, this person made this mistake, this person made this mistake, people aren't as fearful to kind of own up to it, I guess you could say. So
Yeah.
yeah, that's a huge point.
I think one of the biggest benefits of it is that it creates a sense of responsibility and accountability. And actually, it takes away fear as a motivator for not making mistakes and replaces it with a sense of responsibility and
Yes.
accountability. And it also gives you a sense of ownership in what you're doing.
Yep. I was just going to say
Right?
leadership as well. I think
Yes.
it, brings up that sense of, I can be a leader. I can own up to my mistakes and teach people, and then be their mentor when they have a near miss, or, just kind of let them know, like, it's okay. Everyone makes these mistakes, but it's like what you do afterwards that means more than like what happened in the past.
That is so well put, because I think that no matter what your role in a healthcare organization or any organization,
Mm-hmm.
I think that we're all leaders.
I
Okay.
agree.
And, in my career as a doctor, I met leaders that were my colleagues, nurses, techs, x-ray techs, the janitorial staff, the security staff. To me, I look at as a leader is somebody who takes responsibility for what they do, takes ownership for what they do, is concerned about the welfare of everybody they work with and their patients, and wants to teach. To me, those are the fundamental aspects of being a leader. And I think anybody is a leader. I don't care where you are in your training. When you're a med student, when you're a nursing student, when you're doing your first clinical, you
Mm-hmm.
can be a leader. And that also brings up the point, there is no such thing as a stupid question.
I completely agree.
You
That's
know,
great.
and I think what's that?
I said that's been ingrained into my head since the start of high school, even, because that's a fear. A lot of people fear, if I ask this question, but there's some statistic out there that a certain percentage of the classroom is thinking the same question, so you might as well just ask it. That's kind of what we were taught as
Yeah.
well. Yeah.
Yeah. No, I mean, as long as you are sincere in what you want to do and that you want to learn, then there isn't. I mean, I think if you insincerely ask a question, it can be a stupid question, but it just depends on your motivations uh,
Absolutely.
for asking it. Yeah.
That's interesting. Gosh, yeah, this is a really good conversation. I do want to ask, so I am just going to tell the platform here that Sunday is National Cancer Survivor Day. So another reason why we are speaking with Dr. Mausner is because he is a cancer survivor. And I just wanted to kind of ask, can you maybe run us through your journey with cancer and kind of, did that change your career? How did that change your life? And just kind of maybe give us specifics that you feel comfortable with sharing.
Yeah. Yeah. No, I'd be honored to share it. And one of the things as I was going through that journey, one of the most important things to me is to pay back.
Mm-hmm.
And I think this is part of paying back is sharing your experience. Um, it was 9 years ago, almost exactly 9 years ago, I felt like I was at the height of my career. I mean, I felt great. Physically, I was enjoying my job. I thought I was really healthy. I'm one of those crazy people that would wake up at 5 in the morning to go running before a day shift, or,
That's
you
awesome.
know, go running at, after a night shift and exercise. And,
Oh my gosh.
we always bought food at Whole Foods and really felt we were
Mm-hmm.
leading a healthy white lifestyle. And sure enough, about a month before I was diagnosed, I started for the first time in my life having a sensation of indigestion or heartburn. Okay.
Mm-hmm.
And I had never experienced that before. It was like a burning in my chest. I was going, wow, that's heartburn. And then it would go away a little if I took some antacid, or I'm a doctor. So I thought, I'll try for a little while. I'm going to put myself on Prilosec, OTC. You should never treat yourself. But I thought, okay, I'll try that for a little while. But after about a week or two, I was thinking, there's something really wrong here. And I'm really lucky that I was open to that and didn't ignore it.
Mm-hmm.
So I made an appointment with one of my colleagues who's a GI doctor, and we decided to scope me, do an endoscopy.
Mm-hmm.
So the day of my endoscopy, my wife and I went in, and she's a nurse, so they let her into the endoscopy suite. And, here they put the IV in, and we're all joking and laughing about, oh, too much caffeine and these night shifts are just getting to you. And, here we're gonna give you a little medicine, you'll wake up fine, and we'll tell you to just, change your lifestyle a little bit. And so I go to sleep and I wake up and I'm looking up, and my GI doctor, she's crying, and my wife is in shock. And I had a tumor at the base of my esophagus. And what the biopsy showed was that I had a stage 2B adenocarcinoma of the esophagus, so esophageal cancer, which is one of the nastier cancers. This particular cancer is mostly caused by reflux, so gastrointestinal reflux.
Mm-hmm.
And I had probably had reflux for decades, and I just never had symptoms. Or I'm such a hard driving person, maybe I ignored them. And the lifestyle of, coming home at 3 a.m. and eating a dinner and going to sleep, it finally caught up. There was a tumor formed, and then it became symptomatic because it had eroded into the wall of the esophagus. So that's a fairly nasty cancer. And at that stage, especially at the time it was diagnosed, that cancer tends to metastasize fairly early and had a pretty high mortality rate. So from the minute I was told that, I became a patient, and just found myself being wheeled from the endoscopy suite to the CT scanner, and over the next days and weeks, getting staged for, fully staged for your cancer, and then going into cancer therapy. And the therapy was pretty aggressive. You have simultaneous chemo and radiation therapy. And then they give you about 6 weeks to heal. And then you have an esophagectomy, which is a very invasive surgery where they go into your chest and your stomach simultaneously, and they take the top part of your esophagus and the top part of your stomach off, and then they attach the two together.
Okay.
And so I was really lucky. I was a clinical cure. There was no sign of disease. You're never really cured, but I was in remission, no sign of disease. And I thought, wow, I'm just going to get over this, and I'm going to be back at work in 6 months. And coming back from that type of surgery is really challenging, because that's kind of at your core, your esophagus and your stomach, and it's how you get your nutrition. And you can have complications. There's a condition called dumping syndrome, where when you eat, especially if you eat in a too rushed of a fashion, or you just have bad luck, the food gets dumped down into the small intestine, and then it causes a reaction with severe abdominal pain and low blood sugar. And when you have one of those spells, it can take you hours to recover. You can't think straight, and it's a really horrible experience. And because of that complication, because I would get that periodically, I realized I could not go back to the ER as a bedside doc. Being an ER doc it's a very athletic sport. You got to be 100% all the time. I mean, at 2 a.m. when you get a call from the radio that there's a 3-year-old baby in cardiac arrest, a 3-year-old child in cardiac arrest, you've got to be 100% your best. And obviously you can't do that if that type of thing could happen. So it really changed my life. I went from, one day, wow, I just love this field. I'm really on top of my game. I'm, so mature in my field after 25 years to, you know what, I'm just not going to be able to do that. So I'm going to have to find something else to do.
And how do you, I mean, I'm just listening to this like, wow, but how did you feel in that moment when you knew like, I can't be back in the emergency room, helping these people that I've been doing for how many years? How did you feel like right then and there? Like, I need to make this transition. Were you optimistic? Were you pessimistic? Or is it more so, like your outlook on everything? How did that change?
It was a lot of ups and downs.
Mm-hmm.
Because, when you go through, first of all, when you're recovering from chemo and radiation and surgery,
Mm-hmm.
you haven't exercised for a long time. You can't eat the way you normally do. And it, when up until that time in my life, I'd never faced a physical limitation, and this was just an outright physical limitation. And so at times it was incredibly frustrating. At
Mm-hmm.
times, you felt angry and frustrated about that.
Mm-hmm.
And you go, why me? Nobody in my family's ever had anything like this.
And you've been
Why me?
exercising, eating right, doing all the right things. Yeah.
Yeah, I did everything right. And then you just start to accept. And I think that's one of the key points when I think, I think one of the most powerful words and concepts is resilience.
Mm-hmm.
And I think that everybody has a capacity for resilient, and it, I'm really lucky because I have such a wonderful marriage and family and friends. And also I just really came to think, I'm not done yet.
Mm-hmm.
There's more that I want to do.
That's so.
And so it really motivated me to get as best as I can.
Mm-hmm.
If you look at me now, I look pretty healthy, and
Yeah.
I run and I'm active. I just
Good for you.
can't do that profession that I do, and I have to be really careful about when I eat and drink. But you know what? I'm really lucky to be able to do that. You know,
And to
and I
go back
think,
to some of those normals that you used to have, to kind of
yeah,
recognize that, yes, and it's okay that, this goes for any type of barrier or, a stopping point for anyone on a journey of any sort. There's going to be these pauses or roadblocks, but like you said, that resiliency and the ability to kind of recognize like your why of like why you're doing this, and to constantly remind yourself of that, I think is important, especially as, you especially in your journey, but students as well. If they are going, in their undergrad, a lot of people have, even I mean, I started at lacrosse and then I decided to go nursing route. So then I moved, and there's all these things that you kind of, it becomes, you become fearful of like what's next. But I think that's a point of
right.
growth. And maybe you can speak to that. Do you feel that your transition from, emergency med to what you're doing now was difficult? Did you grow a lot in this time period, or how do you feel now that you're not doing the hospital piece of it?
I think that at times I really, really miss it,
Mm-hmm.
especially because I'm on faculty at the medical school and I'm interacting with all my colleagues and friends who are practicing. But on the other hand, I am so grateful to be where I am and to be alive and to have opportunities to teach and opportunities to continue to learn. You know, the people I have found that the people I respect most are the people who have gone through bad times
Mm-hmm.
and overcome bad times.
I
I
agree.
think, some people are just really lucky
Mm-hmm.
and they go
Yeah.
through life and everything falls in place, and I am so happy for them that they have
Mm-hmm.
that. But I think when you have to overcome really bad situations, an illness, a limitation, a
Mm-hmm.
loss, and then you find it within yourself to grow from it and to become stronger from it, I think that gives you a character and a maturity that a lot of people don't get the opportunity to develop, but
Mm-hmm.
it also gives you an empathy. And I think, one of the most important things to be a healthcare provider is to be empathic.
Mhm.
And empathy means it's more than going through the motions. It's truly caring about what you do and the people that you're taking care of and the people that you work for. And I think that um, anybody can feel that. And I think most people are empathic. But when you've gone through something like that, when you see a cancer patient, for example, I know what they're going through.
Exactly.
You know, when I when I see somebody who's dehydrated or in pain, I know what they're going through. When I see somebody who's paraplegic, I don't know exactly what they're going through, but I know, wow, I can identify with the limitation of not being able to do what you want to do. And there are so many people, obviously, that are so much worse off than I am. And I'm so grateful for what I have. But I actually am grateful for the experiences that I have. I feel like I've learned from them. And it makes me want to pay back. It makes me, really want to help other people learn from those experiences.
I think just sharing your story is even for me, it's incredible to hear, you know, what you've done now afterwards. Like, you brought up even air before, and people kind of recognizing that not everything is going to go the way you kind of expect it to, but how you persevere, and you kind of have this sense of relentlessness where you just have to push through if it's something that you want to get there. And if it's something that you want to get to, you'll do anything in your power to like get back to your normals, to be able to run again and be able to be active, and not be as frustrated, but to take your experiences that you've had and better your future. I am just like moved by your story. So I'm very grateful that you're sharing that with us. And I'm so happy that you are still able to practice and do everything that you're doing to teach others and share your story. I think it's incredible.
Well, it's really an honor to do that. And if I can just say one other thing, you can, you don't need to use it if you don't want to.
Oh, definitely.
But
Please, please.
I think one of the most important roles of a teacher is, it's not just teaching facts and knowledge. It's teaching how to deal with circumstances within your field or your profession. So one of the things I really take pride in, that I work with a helicopter emergency air service. I don't, fly anymore. I'm not directly taking care of patients, but I help train and educate our flight nurses and paramedics, and I help develop their protocols, and I do their quality assurance. So when they have a particularly difficult call, or maybe there was a mistake, there could have even made a mistake that might have conceivably led to a bad outcome, or even, maybe a patient died and it's unclear whether mistakes were made that could have contributed to that. I think the biggest role that you can do as a teacher and as a mentor and as a doctor is to take those people through it from a just culture perspective, where we're all human beings, we're all in the front lines. As healthcare providers, truly in the front lines. And I mean, the last few months have really illustrated this. Look at this
Exactly.
coronavirus. I mean, look at the heroism of every healthcare provider that is literally risking their lives to take care of people. But, healthcare providers do that every day because they're putting everything on the line for people, and putting their heart into it. And sometimes things don't go as well as they could. And very often it could be somebody's fault, or there could be contributing factors, or it might not be their fault. But to give people a perspective on that when you're on the front lines, you do the best you can and you learn from it. And if you make mistakes, you incorporate that and you make you a stronger provider, so that other people can benefit from that your next patient can benefit from that. Because there is no way you're going to go through a career in healthcare where you're not going to have those feelings at times,
Right.
where you're not going to have situations like that. And I think that's an overlooked part of medical
I
education,
agree.
is the reality of what it is to practice in an uncertain, complicated environment.
I think that's an important point to talk about too, is the 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 teaching piece of healthcare professionals. Yes, we're helping with ADLs and a lot of the medical piece of it, but the education piece is just as important for patients, or even as a student, helping educate your other peers, or like you had kind of talked about. I think a big thing for me that I've learned from, whether it be even my parents or professors, is the tools that they give you to persevere, to work through challenges.
Right.
And that kind of builds your sense of personality. Like getting out of nursing school, there's more than just the curriculum piece that I've learned personally. It's more so, how have I grown as a person, and how am I going to implement that as, whether you're studying to be a nurse or a doctor or a physical therapist. I think those are important pieces that sometimes aren't talked about, because sometimes it's more of like an innate thing where you just kind of, you push through it, but other times it's not. And I think talking about it, this is like, I love this conversation because I've learned so much in nursing school aside from the book side of things. So that's awesome. I
Yeah.
really appreciate that conversation.
And one of the things I would say is, the thing that I think a reasonable expectation, obvious expectation of everybody who's pursuing a career in health professions is pursuing excellence.
Mm-hmm.
But pursuing excellence, what does that mean? Does it mean book learning?
Mm-hmm.
Does it mean teamwork? Does it mean, having an emotional quotient in addition to an intelligence quotient? And does it mean developing your empathy? It means all of those things. But one of the things that happens when you're going through this training, it's so demanding and it's so intense at times, is learning how to step back in situations
Mm-hmm.
and learning how to orient yourself and kind of reset yourself.
Right.
And when you're having crazy days, whether it's in school or whether it's on the wards, on clinicals, or whether you're working as a doctor or a nurse, is when you're having those days where you lose track of what you're doing and you lose that sense of self, is to just develop for yourself your mission statement, your purpose,
Your
so
why.
that you can step back and say, wait a minute, this is why I'm doing it. I
Yeah.
need a reset right here. Develop that kind of spidey sense of
Mm-hmm.
when that's happening, especially in emergency situations.
Yep,
It's easy to get
definitely.
carried along. And so I love the concept of a spidey sense. And I think you develop that as you go along, and that makes you better at
I
what you
couldn't
do.
agree more. I could not agree more. That's a good way to kind of wrap this all up. I really
Yeah.
like that piece of it, of the spidey sense. I've never heard of that before, so thank you for sharing that. Uh, well, thank you so much, Dr. Mausner. We really appreciate your insight on everything. And I just wanted to thank you, from me, like just talking with me and me hearing your story, and from everyone on AMP Honors. And I'm going to carry this with me for forever. So I really appreciate it.
It's really an honor, and I'm available to you guys, and I just would love to contribute any way that I can.
Thank you.
And I hope to meet you all someday. So,
Thank you so much.
in person.